Ladies and gentlemen, welcome to today's enlightening episode on Spark Igniting Minds, where we explore the fascinating world of homeopathy, holistic health and integrative medicine. Our guest today is a true pioneer in the field, someone who has seamlessly blended modern psychiatry, traditional yoga and the centuries-old practice of homeopathy into a transformative approach to healing. Dr. Bhavana Gururaj is not just a homeopath. She is a healer with a vision for whole person care. Her work spans from treating complex chronic illnesses to mental health conditions like anxiety and depression, all through the lens of individualized patient-centered care. What makes Dr. Bhavana truly stand out is her ability to integrate these different modalities using homeopathy to complement conventional treatments, improve patient outcomes, and even address side effects in serious conditions like cancer. From her extensive work in rural healthcare settings to her innovative use of telemedicine during the COVID-19 pandemic, Dr. Bhavana's commitment to accessible holistic care knows no bounds. Today we are going to uncover her journey, insights and the remarkable power of homeopathy to heal on a deeper level. It is truly inspiring to have Dr. Bhavana with us. Namaskara, Dr. Bhavana. Dr. Bhavana, it gives me immense pleasure today to have you on my platform, Spark Igniting Minds. You have integrated homeopathy, yoga instruction and also psychiatry in a very excellent way, I can say. As a renowned expert in these disciplines, let us explore the holistic homeopathy and also wellness today. And homeopathy being an ancient art, maybe it is followed from past 200 years, I can say, and its core principle being like yours like. Okay, so let us address the different aspects of healthcare today, and I extend a very warm, hearty welcome to my platform, Spark Igniting Minds.
Namaste, Sahana. It's nice to be here, and I think I'm too early to be here also. So it's a long way to go on.
Yeah.
But I'll start with this. Sahanau bhavatu, sahanau bhunattu, sahaviryam karavavahai, tejasvi namaditamastu ma vidvishavahai. Om Shanti, Shanti, Shanti. Let this, this Sahanau is we are together with this podcast, try to illuminate, give an insight to the viewers regarding homeopathy. And my journey with homeopathy was really very accidental, I can tell you. But I think it's more of a divine plan. So, actually I was, when I was pursuing my second PUC, I was an aspirant of MBBS degree like any other of those times. Usually those were the time where either they were opting for MBBS or BE. But when I had completed my 6 months of my second PUC, my mother fell sick. So it was some 3 months of severe vomiting, which we could not address with the conventional medicine.
Right.
So we started, looking at all possible ways of getting her better, but it wasn't. So we went to a bigger hospitals, and there they said we have to do some exploratory laparotomy for her to know what is the problem.
Right.
Because all her reports were normal. Right. But none of the conventional medicine treatments could address her vomiting. She had severe vomiting, and it was actually a severe gastritis, and she was also undergoing some menopausal changes, this which I could understand now. Then we were, all were in, kind of a lot of, sadness or something like that. So we were thinking as what to do, because those times, I'm talking about 30 years back, exploratory laparotomy was something, a very huge thing to take to our minds. Then one evening, my uncle, Srinivas, my mother's sister's husband, he came and he said, why don't you give a try to homeopathy? Then he took us to one known doctor At that time, Dr. Krishna Rao, he was practicing in Rajajinagar.
Okay.
So, believe me, this is my experience. My mother's vomiting of 3 months settled in a day.
Right.
That was a turning point to my understanding. And when I went to him, he was a very senior homeopathic physician. He was a very senior physician, homeopathic physician, and it seems that he had learned homeopathy to an Himalayan sage.
Okay.
See, those were the times homeopathy was something which was practiced by laymen.
Right.
It was not an actual course-like thing that was there.
Now it has become a mainstream course.
Yes. Now it is in par with the MBBS curriculum.
Right.
So we went with all the reports of my mother. We were supposed to give him. He said no. I don't need reports. Madam, you tell me your symptoms. Now that was my first learning of homeopathy.
Okay.
Reports do not define patients.
Right.
Very important it is. They can be some some kind of guidance to us, but they are not everything of the patient. So we just asked my mother's few symptoms, gave some few pills of medicine, and magically it cured her vomiting. And she was a chronic migraine patient. That also went on over a course of medicine, and she was healthy. It was very surprising, shocking, and everything. Now this event changed my understanding. So I was an aspirant of MBBS. So I said I'll go to homeopathy.
Oh, so you changed your path from going to MBBS to homeopathy.
Yes.
You found homeopathy more exciting.
Exactly.
Yes.
I took all my marks cards to Indian system of boards. And the director, Dr. Angadi, was there. He was an Ayurvedic physician. He saw my mark, and then there was no CET for homeopathy.
Okay.
So he saw my marks. He said, "Are you sure you are taking homeopathy? Think twice."
Okay.
I had something was fixed in my mind.
Okay.
I said, "No, sir, I'm going for it."
Yeah.
He said, "See, the people are opting for Ayurveda also, and you have a last chance now. See if whether you're going for Ayurveda or homeopathy." I said, "No, homeopathy, because I've seen that." So I said, "I'll learn this system," and that's how I came to homeopathy. Then my journey during my college was all a very different thing, because when I started my journey in homeopathy, see, that's how I say it's a divine plan. Now homeopathy became a part of Rajiv Gandhi University of Health Science. So that was in 1996, where Karnataka state government defined all the alternative system into one Rajiv Gandhi University of Health Science.
Right.
So there, everything became methodical. Study became methodical. We had all the MBBS subjects like anatomy, physiology, homeo, and our subjects too. What and all curriculum was there for MBBS was there with us. Along with that, we studied homeopathic pharmacy, and then we had a very interesting subject called as organ and philosophy. And these were the subjects that
I
we
think
studied.
philosophy is also somewhere integrated into homeopathy, isn't it? So you do not take the reports. More than the reports, you understand the symptoms of the patient and the patient's condition, and you want to hear from the patient's mouth. So this is a wonderful medicinal system, I can say. And your journey is very fascinating. How the homeopathy, why you took into homeopathy, and more than MBBS, you were attracted to something which you saw practically that gave results. So how has your experience in yoga instruction influenced your homeopathy practice?
Okay. Now I'll add little more of how this homeopathy actually defined me as a person, basically. See, when I started my journey, I started with Ashwini Homeo Clinic as my practice. My Dr. Madan was my guru, guidance, everything. He started his practice from Dr. A.V. Krishnamurthy. Dr. A.V. Krishnamurthy was a BSc Textiles by graduation. He was working in defense. He had severe diarrhea, and that was cured by homeopathy. Again, this was something very interestingly fascinated him. And believe me, he practiced Ashwini at DVG Road, now in DVG Road. There, he practiced homeopathy for 2 years without charging any medicine to patients. Just to make them understand that there is a system which does more than the other conventional medicine. So that's how it is. And then Dr.
So these are your gurus or your mentors, we can say, Krishnamurti and Madan. You have completely received your knowledge from Madan.
Yes.
Isn't it? So very nice. So how do you integrate your knowledge of yoga instruction into homeopathy?
After with many years of my practice, I understood homeopathic practice is more at the subtle level.
Okay.
See, understanding science is always from from gross to subtle. So you understand science at the gross level and you understand science at the subtle level.
Okay.
It is something like your quantum physics and Newtonian physics.
Okay.
It is the same system, understanding at the smaller and the larger way. In homeopathy and yoga is understanding the human body at the subtle way.
Okay.
What it is to do for conventional system of medicine at the gross level, homeopathy and yoga does at the subtle level. So this interested me and I wanted, because I used to get patients who were asking, Madam, I am doing this asana, is it okay for me?
Okay.
So that always, I was like, say no or yes, I should know what that asana is.
Right.
So I decided I will do my yoga classes with S. Vyasa. Actually, Dr. Nagendra Nagratna, who are running a very big institute of S. Vyasa at Jigani.
Okay.
I met Dr. Nagratna also. She in fact insisted me doing research in homeopathy and yoga, but I was very keen on my practice. So I said I have to be with my practice.
Okay.
But I took up yoga. That gave a different dimension to understanding of homeopathy as well.
Okay.
So what we do now is we understand the patient as how any other doctor, clinician will do, diagnose them, understand with the homeopathic perspective and advise yoga wherever is necessary.
Okay.
That's how we have integrated the practice.
Okay, so this yoga is also it's an ancient art again. From so many years, India has been, it is originated from India, I can say. So even homeopathy, I think, where has homeopathy originated?
Yeah. See, in 1800s, it was an epidemic of malaria. Like how it was epidemic of corona, then it was epidemic of malaria.
Okay.
So many people got cured by Syncona, a drug. And homeopathy was founded by an allopathic doctor. The doctor, he says, conventional medicine who was practicing.
Okay.
Rather, I can
say you used to get from that quinine tree, I think,
exactly.
the Syncona, for malaria.
Yes.
Yes.
This was one thing which brought him into curiosity of how this cures malaria.
Okay.
So what he did was he took that quinine bark, the juice of the bark, and he saw that he came through the symptoms like malaria. So this was an eye-opening for him. It's like that apple for the Newton. So he said something which is curing malaria is also causing malaria-like symptoms.
Oh,
so
that is like cures like.
Exactly.
Oh.
Then he started experimenting on many other drugs.
Right.
So then he could understand what has the capacity to cause will also have the capacity to cure. At the gross level, it causes. At the subtle level, it
something vaccination also is done. Something in the same principle, I think. Isn't it?
It's very similar to vaccination principle only.
Right.
But not exactly the kind of vaccination because homeopathic medicines are proved on human beings. We don't.
So many of the normal people cannot understand what is subtle kind of understanding and all those. So I think there are a lot of misconceptions both in homeopathy and in yoga. So what are some common misconceptions that you have heard of homeopathy and how do you encounter them?
Basically, the first thing patients come to me and ask, is homeopathy fast? Or they tell, Madam, idu slow agattalva. That is the first thing. First misconception. I tell them, see, we treat fevers just in a day. We don't require 2-3 days or something. Any fever. And homeopathy is fast.
Faster than the conventional medicine.
Yes.
Okay.
Provided there are two things that has to work on that.
Right.
One is patient should be very keen on observing themselves and tell the symptoms. Doctor also should be equally observant. See, it is like that higher the intellectual faculty. Something doctor also should be a very keen observer. See, in many of my cases, sometimes I get the clue of the patient while they are leaving the room. Like once the patient enters, they may tell so many symptoms. and even the behavioral changes during their illness is also addressed through homeopathy. So first conception is that it is very slow. Second thing is our homeopathic doctors are real doctors. That is one thing they ask. When I write investigations, madam, ನೀವು investigations ಬರೀತೀರಾ? I say it's a human body. I need to know what is your changes in your body. So investigations are also equally important for a homeopathic doctor. This is another thing that I have seen. And most of the times I see homeopathy, maybe they are not scientific in their approach. This is another misconception they have. I would say homeopathy is a blend of science and art. You need that scientific understanding of how a human body functions, and the artistic approach is you have to understand the patient. That requires little skill, and that is why the newcome doctors will take little more time to upgrade their skills. It's a skillful job of assessing the patient at the mental level. Not all people come and tell.
So how do you convince this to the patient? Because patient comes with so many, investigate martira, or you a real doctor. These kind of questions really puts you in spin actually. Yes.
So I tell them, I make them tell them that this is how homeopathy is. And I also tell them it is the most, I don't understand this modern medicine is not the actual modern medicine. When you look at the history, understand homeopathy is the modern medicine. Because it was founded by an allopathic doctors. Allopathic doctor, contributed by many allopathic doctors. I'm telling you.
So many of the allopathic doctors found remedy in homeopathy more than allopathy.
Yes.
So this we should believe as a mode of science and a mode of yes.
So and I tell them we need to know about you. So we need investigations for you, and we are also working on certain principles.
Right.
So for that we are also working on that background. So I convince them that way. But I think Sahana, those days are gone now. Like when I started my career, believe me,
when it has become a mainstream course, people would have understood that this is also
more so after post-corona.
Right.
Post-corona, people could understand that alternative system has a major role to play also.
And you have played a major role in really controlling the corona, I can say, especially in India. So you said homeopathy is originated from which place?
Germany.
Yes.
He's a German doctor. He was a German doctor. Who was practicing allopathy.
Right.
He was fed up with his practice. I mean, rather frustrated. Or you can also tell that he was more conscientious doctor. So he was understanding chronic cases. He was simply seeing patients. Like there are certain chronic diseases where there is no cure in allopathy, and you simply keep them on medications for longer period of time. Now this touched the heart of Dr. Samuel Hahnemann. He said, I have to do something more for my patients.
Correct.
So something like this comes only when you have that inner insight within you. So then he came up with theory of miasms. Miasm is a theory of general disposition of a patient to get a disease. I tell this, if there are 4 members in a family, not all of them will get diabetes.
Correct.
Same diet, same thing they'll be. Then why this person got diabetes?
Maybe hereditary.
Hereditary, yes. Hereditary also, you understand, if there are 2 or 3 children, not all of them will get diabetes.
Correct.
So this is something we call as inner predispositions. And this is more related to stress levels of the patient also. That's where we individualize the patient.
Right. This is an individualized medicine, we can say.
It is holistic and individualized.
Holistic and individualized. That is fantastic, Bhavana. And also if you can relate one of the incident where you have really cured a major incident or a notable case where you felt, yes, homeopathy had a significant remedy for this. So which, can you relate that kind of incident?
There are many cases like that. One such case I have to say about, what I want to tell you on this platform is how very important for the doctors to consider the holistic approach. So I had a patient of 65-year-old who was coming down with syncopal attacks. Syncopal is they fall, it's a giddiness and they just faint.
Because of the heat, something like a heat stroke?
Something like that, but they faint. So they have started evaluating the patient. So first they have taken her to a general physician. The doctor, they said, generally I feel the patient is okay, but get her checked with cardiology, and cardiology, he referred her to cardiology. Now the relatives took her to cardiology department, where that halter was done, 24 hours of ECG was picked up, and then they said there is no problem with the cardiology. So cardiology ruled out her problem, but it did not ruled out of her suffering. She was fainting.
She was still fainting.
She was still fainting. She was falling.
But they could find out what was the reason.
What was the reason? Then they took her to neurology.
Okay.
There also all investigations were done, including MRI. And then they said there is no problem with the neurology. We have no. You get back to your general physician.
Okay.
Now, my understanding is, if with so much of investigations, so much of diagnostic procedures, still we are not able to find the problem with the patient, then we are somewhere missing out something.
Okay.
So anyways, most of the times I see patients coming from other hands only.
Okay.
They don't directly come to homeopathy.
After they fail in allopathy, then they come to homeopathy.
So she was got to my clinic,
Yeah.
and I just took her history. I said, it's simple, I'm telling you. There are many cases like that. Then I saw her reports, and I came to know that she was on some antipsychotic drugs also. She was an hypertensive patient, diabetic and antipsychotic drugs. I said, now we'll have to cut down these drugs because they have an effect on the extrapyramidal tract.
Yes.
So we will just taper these doses and let us see.
Okay.
Believe me, I didn't prescribe any medicine, but this understanding of the patient improved her because we just reduced her dosages that she was having.
Okay.
The problem with the conventional medicine is polypharmacy. Like you have for every disease you have one drug, and you don't know still what is the combined effect of these drugs in the body.
So they don't treat holistically. For every one disease they have a drug,
Yes.
and that is the end of it. But when they come to you,
Yes.
you understand
Yes.
not only that particular disease, and she is suffering from other things also.
Yes.
You get a holistic approach of the patient, and then that works miracles.
It was really a surprise for the patients,
Yeah.
They said, Madam, just by reducing the dosage, she was
Yeah.
better.
Yeah,
So
you
this
need
is
not
holistic
give
approach.
any drug also.
Exactly.
This is
holistic
the
in
understanding
approach.
of the patient is more important than just prescribing a drug, I can say. Is it not so? So how do you integrate your knowledge of psychiatry with homeopathy in your practice?
Basically, when I understood homeopathy, I understood it to be more related to mind studies. Because we have to understand the patient. It is something like Sigmund Freud's psychoanalysis. Then it's a behavioral thing that is going on in the clinic that we observe through the patients.
Correct.
So it's a multitude task that we will be doing with the patients. So I thought I will do some extensive studies in psychiatry so that I can. Another thing is for psychiatric illness, till date, I mean till recently, we had very minimal answers in homeopathy.
Okay.
Because psychiatric illness is very difficult to cure. They are one-sided diseases. As Hannibal said,
Psychiatry is usually, there is an imbalance in the chemicals in the brain. That's what they say. I don't know whether it is schizophrenia, depression, or what do they say, some syndrome.
Yes.
So all these, I think, are based on those chemicals.
Yes,
But
yes.
your understanding must be something different.
Yeah, something more subtle than that.
Yes.
It's like, see, allopathic doctors view psychiatric illness as the biophysical module.
Okay.
Like, there are some, as you said, there are some changes in the brain, some irregularities in the neurotransmitters,
Right.
and that's how they'll end up in some thought delusions and psychotic disorders or neurotic disorders. This is one way of understanding the disease module. But after I getting my fellowship in psychiatry, I actually worked with Dr. Mahesh Gandhi. Now
Okay.
he was my mentor in fellowship.
He was from Mumbai.
He's from Mumbai. Basically a psychiatrist, allopathic psychiatrist, who could understand that allopathy in psychiatry has a very superficial role in treating the patients because most of the psychiatric drugs were given at the level of sedation or tranquilizing
Yes.
thing. So there was nothing that was deeper understanding of the patient, or something deeper happened to patient.
Yeah.
Even now we see Nimans, no? If you just stand there, huge number of patients will be going for ECTs. It is just they go, get the ECT done and then come back. So he was also...
And the drugs that they prescribe, like Respiridon and things like that, you know, there's got a lot of side effects. And the human being does not be, normal at all. He is always under, he will be sedative, he will be sleeping either, or he is not active at all. This kind of a side effect is there in allopathy.
Yeah, definitely. So sir saw this, and he was also an interesting, he was interested in homeopathy as well. So he brought this understanding of personal evolution model, which is a combination of understanding of human mind through allopathic means also, how the regular psychiatrists do, plus we have something called as in homeopathy called as personal evolution module.
Okay.
So we understand, this is in understanding of Erik Erikson's psychosocial developmental module.
Okay.
Basically, this understanding of him, it brought a new hopes to all of us in taking cases of anxiety neurosis, OCDs, panic disorders, because post-corona, believe me, huge number of panic disorder cases. It could be post-traumatic stress disorder, phobias, and what I understand is coming days, we are seeing more of psychiatric illness more.
Now we are not shy of saying that we have a psychiatric disease.
Exactly.
Otherwise, they used to hide, and it was it was a trauma or a kind of, a person having a psychiatric disease means he was kept aloof.
Yes.
Isn't it?
Yeah. There were some myths about the psychiatric illnesses also. So, understanding this psychiatric illness through personal evolution module, we could understand that every human being enters some 8 stages of their life. This is very simple, nothing very, very technical also.
Okay.
Like we all are in womb, in our mother's womb.
Correct.
Then we take the process of delivery. Then there is infancy life. Infancy is that 0 to 1 year. Then after 1 year is the childhood.
Okay.
Then early childhood. Then we enter adolescence. Then adult. Adult we have young adult, little closer to adolescence, and then we have mature adult.
Okay.
Mature adult is something we talk around 40 to 50 years,
Right.
where now we have taken the responsibility of the family and things like. After that is the old age. Now this is a cycle which all of us know.
Okay.
Now what we do in homeopathy is we try to understand where the patient is stuck in these stages, and we relate it to our medicines. So by understanding this, we understand the nature of the patient. Homeopathic history itself is very vast.
Okay.
Most of the times our senior doctors tell that if a well taken case is half cured, you sit with the patient for 45 minutes and then you understand every aspect of the patient. Patient is better.
Yeah.
No need of medication also.
So that's what it has, physical manifestations also. That is wonderful. If you can cite a case or of this kind of what you spoke about, Erik Erikson's model. So I would like to hear, how did you cure a psychiatric disease? Like you were mentioning about some lack in some. If you can mention it.
Definitely. That case I
Yes.
definitely tell. I had a patient from a very senior post. Actually, his wife brought to me, and then he was the thing that he is in depression. There was some interpersonal conflicts at home as well, as usual, daughter-in-law, mother-in-law issues, and then he was not able to balance between that. Added to it, he had some pressure in the office.
Right.
So it was a classical case of depression. He was not talking to anybody. This went on for 2-3 months.
Right.
Then his manager asked his wife, see, he's not even doing well in his office, so why don't you take him to a psychiatrist? She was my patient. So anyways, as you said, before going to psychiatrist, everybody will think twice. Then she said, okay, I'll see my doctor first. If she advises, I'll take him to psychiatrist. It's a classical typical case of depression as I understood him, because he was not ready to talk to me also.
Okay.
First visit, it was only the complaint from the wife that he's not interested, he's not talking, he sits in one room, he doesn't even come out. This, how many days can we go like this, and all that. Then after 1 or 2 visits, he started talking to me. So during those 2 visits, I actually had told him that you are undergoing this, give me some time. So we will see how you as a person, and then I can prescribe the medicine. So we started from his childhood. So everywhere, now he was see, there is something called as, this is very interesting, Sahana. I tell you, we have this, that disease is delusion, awareness is health.
Okay.
So everybody of us have some delusions about our own selves and about the people around us. It's our own ideas.
Yes.
It need not be that way at all. So this delusion, when you understand, you are right through the remedy.
Okay. You yourself can find out a solution for your own problem.
Exactly.
Yes.
So when I took his history, he was telling that, see, I lost my father at a very early age. So my mother took care of me. We are 2 brothers. And my uncles used to, though they used to take care of me well, but they also put some responsibilities on me. That was the childhood, is the age of enjoying, no? So I said how it is. So he said, see, I used to come from my school. I used to keep my bag in the room, and then my uncle used to tell, go get something from the grocery shop. I had to run and I had to come back. So this was the thing, that he was feeling that everybody is using me.
Okay.
This was his delusion. Not necessarily they were using him. It was his understanding.
Yes.
This is what we have to understand in a patient. So and this came up in every areas of his life. In my mother used me. She's taking care of my brother, but not me. My wife is using my patients. I'm so
No, his mindset was like that. Every time he used to compare himself with others, and he used to think, I have been used. I have been used. This kind.
So even in the office, he got this feeling of that I'm used by my boss. He takes all the work from me. And there is no appreciation, appraisals, nothing. So this was the feeling that went through and through in the case.
Correct.
And it went on for more than 1 hour, I think. Then I could understand that he was, that energy of him was like a horse. So this is one interesting studies in homeopathy that has happened through recent years. We have some pioneers who have developed this idea from like Dr. Rajan Shankaran and Dr. Mahesh Gandhi. They have come up with this idea of we have medicines from all sources. Plant, mineral, animal, sargots and nosodes. Now, if the patient is from an animal kingdom, he will be talking about something like the features which are similar to an animal. So it should be more of a competitiveness, it should be more of a survival issues. So these are the issues. If it is a plant is all about sensitiveness. See how in nature, plant reacts to the changes in the environment. So our patients who receive plant remedies are sensitive to things happening surrounding their usual household or whatever it is. So those are the set of patients who receive plant remedies. And there are patients who receive mineral kind of remedies. They are very structured individuals. As we see, all the minerals
Not very structured.
So now as a homeopath, I have to be a chemist, understanding the periodic table. So we even now sit with periodic table, study the rows and columns of the periodic table, and these rows
and also the structure of each element.
Exactly.
Yes.
And these rows and columns are also understood with Erik Erikson's infancy, childhood. So very interesting it is. Even the plant remedies. Actually,
and now I can understand the principle of what is like cures like again. When it is an animal related stage, you are giving something animal extracted medicine.
So it is like that.
Yes.
So you have to be a botanist as well.
Oh.
So
You have to be a zoologist, you have to be a botanist,
Yes,
you
very
have to be a, know the nature
Yes.
of the person as well as the actual nature.
Nature.
Yes.
So it's very interesting, but very, very, taking your energies also at times.
Right.
Because every patient is from different, you don't know from where they come.
Hmm.
So you have to understand their energy patterns too.
So what role does patient education play in homeopathy, and how do you ensure patients are well informed about their options?
How they get into other streams.
No,
or
you
taking
have to
other-
educate patients, isn't it so? When they come to you, you have to educate them, and they have to choose some options, like when you analyze them or when you take a detailed history of a patient, how do you really
See, I feel
educate them?
I know.
Yeah.
What we all these days, this is something which is happening in the medical field. That every other system doctor will blame the other system doctor, which shouldn't happen.
Yes.
We need to have a comprehensive understanding of what the other system is as well.
Yes.
For example, if a patient comes with a long history of taking some medications, I wouldn't stop them. I say that please be on this, because your doctor has prescribed with some logic there. So I don't want to disturb that. But I want you to take this medicine, see the change in you, and slowly your doctor only will taper the doses of your medicines. This is one way of educating the patient. Many times patient come, oh, I'm taking homeopathy, chalo, I leave all the medications once for all. This shouldn't happen.
And that will not work also.
That will not work also. Because long term they are on medications, you can't cut down their medications. This is one understanding. And second thing is, when you are taking homeo medicines, you should also see there are some qualities of a patient too. How we qualify a doctor. He should be a very clinician, good in observation, good diagnostician, everything. Qualities of patient is, when you are taking one medicine, you should report to the doctor of what medications you are taking, how this has worked for you. This is how, it's just an awareness about what is happening within you, no. You should be aware of
You
it.
should not hide anything from the doctor.
Exactly.
That is very important for a patient.
Yes. This is very important for a holistic treating doctor.
Yes.
It's not.
And homeopathy is all about holistic
Exactly,
treatment.
exactly.
So, patient should be very, very open with the doctor.
See, I'll tell you one example with a case. How this. Actually, I had a case of asthma. A small girl of 8-year-old. She was also getting rashes, eczema on her skin. See, holistically, when we understand, asthma and the skin rashes are a together expression of the disease. Both are related to allergies.
Asthma and
The skin eczema rashes, eczema.
Okay.
Usually we see in some patients either asthma comes up, or when asthma is not there, the skin rashes comes up.
Okay.
Now this patient was convinced by some other who told her, you take homeopathy for asthma, and for the skin she was going for skin doctor. Which was really, I was like, I'm giving my medicines. What is happening with the, and then after so
And
many.
this has become the order of the day, Bhavana. Specialization, specialization, specialization. Then where is a doctor who understands everything of that?
Very true, Sahana, very
Yeah.
true. That whole concept of family doctor is gone these days.
Yes. When we were young, we used to go to one doctor for all our ailments. Now we have to go to hundreds of doctors for different ailments. This has become yes.
Definitely this is one of the what I would say as some kind of wrong way that medical field is going. Idea of specialization is good to some extent,
And then there have to be integration also.
but the patient has to be treated
And
holistically.
integration not only with one kind of system like allopathy. Allopathy can always go with Ayurveda, with yoga, with homeopathy, with naturopathy. So this kind of integration is required to make the patient, come back to
Unfortunately, the science of medicine has become science of business.
Yes, that should not happen.
That's where we are landing up like this. And so for simple flu-like fever which we experienced last 2 years of corona epidemic, we were in utter confusion because there was no correlation from any of the streams. Allopathic doctor said no complementary system of medicine should entertain this. So we were totally barred from raising our voice. Yes, we can cure, but we did our best in our clinics only. during Corona, because they were generally from the government there was nothing like that. I mean, at least after that they started telling take ourselves as a preventive medicine for Corona or something like that. But earlier first wave and all, they said nobody
Even
was
before
taking.
the vaccination and all came,
Yeah.
Corona
Yes.
vaccination, what we took, 3 doses and all that. Even before that, we had controlled in certain
Yes,
extent.
yes.
It's all because of maybe homeopathy.
Yes. See, we treated so many cases, and another one thing which I would like to share at this time is, we were telling from the beginning that every organism, living organism, when there is a disturbance, will show through signs and symptoms.
Right.
Okay? You, as I said in the first part of my interview, that investigations do not define the patient. Now here comes Corona, where RT-PCR was positive, patient was symptomless.
Yes.
So ironic. And we had to lock them in a room.
The symptoms still is positive.
He still is
Yes.
positive, and he has to stay without communicating to anybody. So this was really this was how this thing was not addressed properly.
Okay.
So during those time I did some kind of interviews and at last I also gave up.
But in allopathy also they say, like many of the diseases, even if it is HIV or something like that, there is something called as incubation period. So once the virus enters the body, it takes certain time for it to multiply and then show the signs and symptoms. But he is positive. Is it not so?
Yes, correct.
So maybe I was correlating with that kind of a thing when
Yes,
RT-PCR
but
was.
let us understand, each individual has given by the nature one immune apparatus which works for that individual. So it did not be to every patient. This happens. This is not for every patient that he will undergo incubation and then he will come out with symptoms. No. This is what we tell. You individualize the patient. So what was the thing that happened at that point of time is, really those who are sick were at home without a hospital, without a bed in the hospital, and those who are with no symptoms were already there relaxing in the hospital.
So many people did not get beds, did not get oxygen.
Yes.
So many died.
Yes.
So very, very pathetic situation, I can say.
That
Because the doctors did not understand whom to admit, whom not to admit.
And it actually, lot of pressure was on us only, because we were directly communicating to the patient. Why I tell this, we are small clinics where we have direct communication with the patient. Bigger hospitals will not have that. So all that queries will come up to us only.
Okay.
Of what has to be done, how have to deal with this and things like that. So we were under immense pressure of diluting their conflicts. That was one thing happening. And then we were also looking at whether we have to really shift them to hospital or we can treat them at home.
Okay.
So it was really very challenging for us during
Very,
this.
very challenging, I think, Corona was. So empowering patients through your education is a must, I can say, and you do that very, very, extremely well. That is, I think I'll have to commend you for that. And Bhavana, my next question to you is, can you discuss the significance of personalized treatment plans in homeopathy?
Oh, definitely. We have, as I already said you, that it is individualized. So personalized plan is like you get patients from all kinds of these days. So BP, diabetes is all common to 30-40 year also. So most of the times we include lifestyle changes and also include yoga as a part of their curriculum. Along with that, as I told you, we have an elaborate
Yoga
case
also has got different kinds of yogas.
Yes.
What do you prescribe? Whether it is breathing exercises, anulom, vilom and all that, or do you ask them to do some actual exercise, yogic exercises?
Yeah, yoga is also a very vast. Most of them have thought yoga to be only the asanas, which is not so. So it is again understanding the individual at what level he is.
Right.
So if the patient is at the fact level, we say fact level is patient who do not know much about their emotions. They're just with it like that.
With them.
Just they tell this is my symptom. So for them we prescribe asanas because that is to do at the physical level. Now there are patients who are so with their emotions The moment they come and sit with us, they talk about all their emotions that is coming up to them as stress. So for them, we consider pranayamas. Because if I tell them, they can get that insight. If I talk to this person who is only at the fact level, if I talk them to do sit, close your eyes and meditate, definitely he will not do it practically. Because he doesn't understand how to be in that state. So
that meditative state, you have to focus on your breathing. Otherwise it's not called meditation.
Yes. Meditation is simply awareness.
Aware of your
own
breath.
Yes, aware of your breath.
Yes.
That is why I told you, disease is delusion, awareness is health, and awareness in terms of your breath is spiritual health.
So all are so well interconnected.
They're
so interconnected, and that's amazing. Amazing, I can say. So, how have the perception of homeopathy changed over the years? Like particularly in the context of, we have discussed more about it, but still I want you to be very specific in your answer this time, saying that how homeopathy has changed over the years, and also particularly in the context of modern medicine.
Yes. See, homeopathy, as I already told you, it is a system of medicine which respects the inherent wisdom in the body. We are more to understand what is happening in the body, and we respect that defense mechanisms, because whenever there is a hurt, immediately
body naturally reacts to that.
So something like fever, let us take. We have fever. It is a good defense responses. So we don't call fever as a bad symptom at all. We say, this is how we educate the patient. I say, one day fever, you wait. Nothing is going to happen. 3 days you wait. Only after 3 days it is not under control. Then we will evaluate you on your blood reports. Then we'll see where is the infection. Then we can prescribe on those lines. This is one way of understanding. Now homeopathy also has evolved over years. There were years where we call as homeopathy was only addressing the mind symptom and prescribing the medicines. Now that, as I told you, this personal evolution module with so many other doctors' contribution to homeopathy, we have a very systematic approach. And then, as I told you, there are so many other drugs which are added to homeopathic pharmacopoeia over years. As I told you, this lac-equinum case which I spoke to you. Lac-equinum was not the remedy which was given some 30-40 years back. That was not a remedy in homeopathy at all.
That nobody knew also.
Now that homeopathy
is a new thing which has come up in homeopathy, and it's working very well.
Very well, especially in psychiatric cases. I mean, every dimension it takes, but more so I understand this is very good understanding of cases
in psychiatry. Bhavana, what advice would you like to give to the homeopathic aspects?
Yes. From past 3 years, I've been going to my college as a mentor, especially for the first years. We are talking about mental health in medical students. This is a curriculum which is for all doctors, including MBBS, Ayurveda, Homeopathy. First year they have to undergo some 6 sessions of what is the importance of mental health. Because as doctors, if we don't stay in that composed mind, we will not be able to help our patients. So how we have to equip ourselves, this is one thing. But doctors are also under the stress of performing. You need a lot of skills, not only at the level of memorizing the condition, because anatomy is all about memorizing every nerve, every nerve in the brain, every nerve in your body. So students who are opting for medical student should have a good memory. This is one thing. And Nirantara Abhyasa, that is also should be there. They have to regularly practice. So it is like it is like a lot of pressure for medical students as well, because they have to study and then they have to put it into practice. Even before putting it into practice, they have lot of things to be done at the level of their curriculum, because you have a lot of vivas and everything that is happening. So what I would, especially for students who are going to homeopathy, most of them last 3 years what I have seen, is maybe 1 or 2% are coming with passion to pursue homeopathy. The rest all wanted to become a doctor, did not get seat in MBBS, and then
they want to add a doctor prefix to them, to their names.
That's how I feel homeopathy is not growing. Otherwise, it should have done even more now, because the understanding is very beautiful. Understanding is very scientific. But if the homeopathic doctors are not putting it properly, then the system won't grow.
Correct.
So our understanding should go from how you train the first years, and we have to make them feel proud of what they have done. At least chosen this stream of medicine. And I keep telling them, don't feel bad that you have come to homeopathy, because most of them express
you have
this
to incite that passion into them
yes.
and inspire them and make them understand the whole system is so beautiful in homeopathy. If they don't understand that, they become very, very monotonous doctors.
Very rightly said.
Yes.
Because unless until they don't have passion to pursue this system,
Correct.
over a period of time the system will perish. That is what is my understanding. If I take a BHMS degree and I start practicing allopathy somewhere in the remote of that is what is happening now. So that is not the way. So these students have to be trained well. Of course, Rajendra University.
And for that you should have good teachers also, who have to really inspire them and get into the crux of what is homeopathy all about.
Senior homeopathic doctors, and that's what Dr. Madan is doing. In his Ashwini Homeo Clinic, we have lot of young doctors from Bhavana Medical College.
Correct.
They are sitting with him, and he's showing how each case is getting better with homeo medicines, which conventional medicines have failed. So maybe a case of gangrene. So only when such cases are shown, students will be more inspired to pursue this.
Yes.
Otherwise, they will lose their confidence, because this is not the system that Dolo is for fever or something like that. You have to do more, very, very
This is like cause and effect. That is not
very,
very evident, I think.
Yes.
That they should understand.
They should
That
understand.
kind of subtlety which homeopathy
Exactly.
gives, that has to be understood.
That is mastering the skill.
Yes.
Understanding the patient, giving them the relevant medicine, and I tell them, first you have to become very good clinician. So I would take this platform to tell that for all the complementary system that we are talking now, Ayurveda, the department of Ayush should come as a PG program.
Okay.
I feel this is the relevance, because MBBS is a study of human body, mind, everything.
Basics.
So, basics. Let that go on in the first stage.
First
Only in the PG, it should be PG homeopathy, PG Ayurveda. Then I think it makes a lot of relevance to the practice.
Yeah.
Otherwise, students are like with so much of curriculum to do with homeopathy. How will they do with the learning anatomy, physiology? Everything becomes too huge for them.
And Hana, with so much of passion in you for homeopathy, for this medicine, and you have been a wonderful doctor. I can see the crowd that I see in your clinic. Almost 100 people will be waiting there outside. This kind of crowd puller you are. So with this kind of passion, and you're also doing a thesis on something called as relevance of Vedas in homeopathy. Can you elaborate on this?
Okay.
Yes.
As I told you, understanding mind was an integral part of understanding homeopathy. I took up this fellowship program. When I went through this fellowship program, I understood that understanding the mind also gets into more subtler. There is something more subtler than mind. Right? When you are understanding mind, there should be something more subtler than mind. Then this concept of Pancha Koshas came up.
Okay.
Like we all exist in 5 koshas. This
Kosha means cell.
Koshas is the
What are these Panchakoshas? Can you name them?
Yeah, it is a sheath that we talk about. One is your Annamaya Kosha, your physical body, and then is the Pranamaya Kosha, all the vital activities that take place. Your breathing is a Pranamaya Kosha, so that is the Pranamaya Kosha. Then we have Manomaya Kosha, which is have to do with your mind, and then there is Vijnanamaya Kosha, which has to do with your intellect.
Intellect.
Intellect. And then you have Anandamaya Kosha, which we all call as happiness, spiritual bliss that we call. And each patient is working on certain levels in these koshas. This is where I thought it is very much related to Vedas and yoga. So my guru, yoga guru, is Dr. Shivram. He has done his PhD in yoga. He's a faculty in SVyasa. So I spoke to him about my thesis. He was very generous enough to give me all the materials that he had. When I started studying those, it was I could understand that this comes from Sankhya philosophy. And even in Vasishtha Ramayana, when Rama gets into depression, this is very interesting. Rama gets into depression, and Vasishtha tells him during that period when Rama is in depression, he talks about all these causes of the disease, why there is suffering in human, all this he talks about. There he tells one mention of Adija and Anadija. The cause of the disease is mind. So this understanding, which is very
even for the physical diseases, whatever disabilities, it is all in the mind.
So a lot of studies have been done with this psychosomatic approach.
Even for the cancer, I think many of the cancer patients have survived only because of their what to say, the willpower and
mind and willpower. This one I have to make a mention at this point of time. Just recently, there was one physician called as Hammer. He was an oncologist. Just 2 years back he passed away. He came up with this idea of German new medicine, which is a conflict theory, very much understanding of psychosomatic illnesses. Like he has done extensive studies on cancer. It's like why this patient has come down with cancer, what is the conflict or what is the stress that she has undergone, or why they have come down with the blood cancers. His studies is more than 20,000, 30,000 cases. Unfortunately, that has not come to medical this thing because of some lobbying we have understood, because then cancer becomes a very simple illness.
And people don't want to accept it, especially the doctors.
Because it's a huge industry. Cancer is a huge industry. You know how costly those medicines are. And he has come out with this conflict theory. Hammer. Very interesting to study. Many times I tell my patient, especially who have come down with cancer cases, they come as a homeopathy to take as a complementary medicine also. I ask them to read this Hammer's theory. How your own stress levels affects your body immune system, and the responses in the body will trigger the cancer cells. So that is why.
That is one part. And continuing with your Vedas and homeopathy, we stopped somewhere.
Yes. This is one understanding of these koshas which came up to me. And then even Dr. Mahesh Gandhi speaks about all this. So whatever is happening in nature is happening at the evolution level. See, evolution is part of nature. So evolution is part of Vedas also. So with this understanding, I could relate all the Dashawataras to your Erik Erikson's module. Dashavatara, when you go, it is like Matsya, Kurma. Matsya is that in the water. That is the womb stage. Kurma is the land and the water. That is your infancy stage. You are just out of the mother, still not landed upon the earth. Your connection is with the mother only. This is Kurma. This is how you relate Erik Erikson's module with the 8 psychosocial development in the philosophy, and how you can apply it in the homeopathy also.
In the Dashavatara
also. Rama comes at the school age. When we talk, school age is a age. See, as you understand, school age is the age of disciplining yourself.
Rama is full of discipline.
Exactly. Rama is full of discipline.
What Rama is discipline. Yes.
So this is the understanding of Rama. Vamana is early childhood. That's how it is portrayed as a small child. And the development of ego. So it is the development of ego in Vamana Avatara. Then we go to Krishna. Krishna is in adolescence. We all know he was playful. So this is adolescence. See, each stage has some pros and cons. You mastery certain things in that stage. You struggle with certain things in that stage. So I understood this concept is very much what we are learning in homeopathy. This is how it made me understand that Vedas and homeopathy are the same. I don't want
to interrelated.
Yes. Then is the what we talk about Buddha stage. After Rama, Krishna, Balarama is one stage, we call it as mature adult stage. Adult stage it is, because he was a person who was taking responsibilities, and adult stage is like that. Then when you enter into the older stage, is the Buddha stage, evolved stage, giving back to the society. See, when we all evolve, we love to give back to society as you are doing. It is all how it comes up with evolution. After fulfilling our requirements, we want to give something to the society. This is the evolution of human mind.
Good.
This is the evolution of Dashavatara.
So nicely said. Very nice.
So all connected me, and that's how my studies went on elaborately with Vedas.
Okay.
So we took up Sankhya philosophy, Vasishtha Ramayana, and this Dashavatara.
Okay.
And now I understand it is Lalita Devi, the presiding of Pranamaya Kosha. And I think homeopathy works on this Pranamaya Kosha. So it is working at that subtle energy. Only then we can make this difference in the patient when we prescribe the medicine.
It has been an absolute pleasure talking to you, Bhavana, and the insights that you have given in homeopathy and the passion that you have, and the way you really expressed. I was really fascinated by your study of thesis, whatever you are doing. And also all those theories that you brought up, Erik Erikson theory, wonderful, wonderful. And people should understand the importance of homeopathy, which is no lesser than to any other medicine, Bhavana. Thank you so
Hopefully
much.
Hopefully this should, the main, vision of this is that.
Yes. Thank you so much for being with us.